think I'm going to have a cat making
I was going to say, was that an animal that I just saw?
Yeah, we may have a cat make an appearance in this. Hi, I'm Dr. Chris Salerno, Chief Editor of Dental Economics. You are faced with ethical dilemmas every single day that you are in private practice. I'm joined here by Dr. Mike Meru, who is an expert in ethics. He's the founder of SPIA. Mike, how you doing, man?
Doing great. Thanks for having me, Chris.
Thanks for joining us. So here's a question I'd like to present to you. Let's say you're an associate or an employee dentist. You're working for a group or a solo dentist, doesn't matter. And the word on the street is you've been directed, and the hygienists have been directed, to tell patients that if they have some mandibular anterior crowding, not uncommon, that crowding makes it harder to keep their teeth clean. Therefore, they're more likely to get periodontal disease. Therefore, if they don't sign up for some kind of clear aligner or orthodontic program with you, they're going to lose their teeth, or they're at risk for losing their teeth. And that kind of sounds logical, but that's one of those moments that triggers something that says, I'm not sure if I feel comfortable doing that. Mike, You're an orthodontist as well. Weigh in on this for us.
So I feel like, especially in associateships, you're faced with these type of scenarios all the time. And the tough piece about it is there are morsels of truth in what you just said, right? I mean, long term, if you don't take care of your teeth with mandibular crowding, the likelihood of losing those teeth does go up. Absolutely. But that doesn't tell the whole truth. And that doesn't cover the whole spectrum of patients. I think that breaking down ethics and professionalism is, it's a little bit easier than I think sometimes we make it out to be. It's simple. Everything when it comes to patient care for me comes down to informed consent. I don't think that's completely wrong to have that conversation. I just don't like the way that conversation went. I would say it's something like, hey, patient X, you have a significant amount of mandibular crowding and you are getting a lot of buildup down there. Every time you come in, we're having to go in and scale, root plane, because you're not able to manage it. So if you aren't able to get that under control and get that to a point where that buildup stops accumulating, long term, you might, run into some issues with periodontal disease, bone loss, and loss of teeth. So right now we've got two options. Option A is you can get this under control. Option B is, well, let's go ahead and make this easier on you. I don't know if you've ever thought about aligning your teeth. Let's straighten these things. Let's make it easier for you to manage. Really, those are our two paths. What would work best for you? Again, it comes down to informed consent.
So let me ask you something then. What about a case where there's a patient who barely has a little bit of overlap? Their perio is, let's say, average. Their amount of tartar buildup, it's nothing severe. It's the average amount, a little bit of cleaning twice a year, every 6 months. The slightest bit of overlap. If you as an employee dentist have been directed to advise that patient that they are at risk for having periodontal disease and therefore losing their teeth if they don't have aligner therapy or of some kind, how does that go?
Totally different scenario, right? I've been an associate in 2 different places, and I have been directed to do things like that. And what it comes down to is it's your integrity. We all know that is not necessary. And I chose to go into dentistry because I love people. There's a lot of ways to make money, Chris. Dentistry just happens to be one where I feel really good and I like what I do. So no, you say no. That's absolutely not the truth. And in the end, I believe firmly that, first off, the patients will appreciate it and like you for it. And then most, not all, but I do think most of those who run associateships, whether it be an owner doctor, a DSO, whatever it might be, I think they will respect you for it. And if they don't, and in the end, it turns into conflict, which turns into you lose that job or you leave that job, honestly, you were better off not being there. Why would you want to work for somebody who forces you and even more importantly, patients into a situation like that? So talking through how to have that conversation, I think, is where it's key, because the approach to telling the owner doc or the DSO, I wouldn't do that. I'm not going to destroy my integrity and you know, violate informed consent with patients. So learning how to have that conversation, I think, is the important piece there. Never do it.
Fantastic. Well, if you would like to hear more wisdom from Dr. Mike Meru, check him out at the Principles of Practice Management Conference in Indianapolis, July 12th and 13th. I always enjoy hearing you speak on ethics. You know, and it's funny, we don't think that we face these issues every single day, that you know, ethics is not always black and white. We're faced with very gray areas, and I always appreciate your insights and how we can work ourselves through those challenges. So thank you very much for joining us today.
Absolutely. Thanks, Chris.
Thanks.